just like we do every week, and we've been doing for almost a couple of years now, we have El Señor Marcos Mejia, who's here to visit with us and update us as to what's going on with COVID, vaccines, and other bits of information that are essential at this time in our lives. So, welcome as always. What information do you have for us today?
Thank you, Rafael. Today I have a little bit of a variety of topics. I'd like to start with the topic of equity, just to continue with the subject that we were discussing last week about mental health and the impact in the Latinx community. The Latinx community has experienced more cumulative cases than any other racial or ethnic groups, and is the more impacted by hospitalizations and deaths. In 2020, the life expectancy for this group decreased by 2.1 years for the Latinx community when this is compared with the white non-Hispanic community, for which is 0.7 years decrease in life expectancy for them, compared with 2.1 years in the Latinx community. The death rate for drug overdose increased by 200% among the Latinx residents, as compared to 77% increase for white non-Hispanics residents. The Latinx residents were also the only racial ethnic group that experienced significantly greater than expected suicide deaths in 2020, as compared to the prior 3 years average. The 2021 life expectancy and death analysis are still pending finalization for coroner reports. Reducing the spread is essential to mitigating further medical, mental, and economic harm to low-income communities of colors. If you or someone you know is having a mental health emergency, please call 911. And if you have an urgent need now to talk with someone for counseling or mental health support, you can call Sonoma County 24 Hours Crisis Stabilization Unit. The telephone number is 707-576-8181. That's 707-576-8181. There's another number, a local number, the North Bay Suicide Prevention Hotline of Sonoma County. That's 1-888-587-6373. Now, for progress in vaccination, I can share that we're closing the 1 million doses applied. Currently, it's 983,000 for this week. Applied to the Sonoma County residents. 79.2% of the eligible population 5 years and older is completely vaccinated, and another 7.9% of the population is partially vaccinated. Almost 61% of the county has received boosters for those that are eligible. Our focus continues to encourage people to get their booster shots that have proved great prevention against Omicron. And also that everyone wears a high quality mask, as those respirators, N95s or the KN95, along with the pediatric vaccinations. Boosters provide protections against the worst outcomes of COVID, which are severe illness, hospitalizations, and death. The breakthrough cases in vaccinated people tend to be mild or asymptomatic. Unvaccinated people are at far greater risk. People who are unvaccinated here in the county are 16.5 times more likely to be hospitalized if they get COVID, and they are 13.2 times more likely to die from COVID. Now, a little bit of the status of the county health order regarding large gathering. There currently are no plans to extend the county health order that was issued in January 10th that canceled large gatherings to slow the spread of the Omicron variant here in the county. The order is to remain in effect until February 11. Large gatherings of more than 50 people indoors or more than 100 people outdoors, where social distance is not feasible, are prohibited for the duration of the order. COVID-19 cases are declining, and our officer, Dr. Sundari Mays, last week clarified that health order. for indoors, these events now include 50 spectators. The total number of attendees does not include staff involved with the event, the media, the players, or the performers are extra people that can be present along with those 50 spectators. Dr. May said the health order helped to reduce Sonoma County's case rate from a record high of nearly 250 new cases per day per 100,000 residents. The rate now is 154 new cases per day per 100,000 residents. She also said that the Omicron surge appears to have peaked with a downward trend throughout the Bay Area. Regarding local case rates, hospitalizations, and death, the new local case rates and hospitalizations appear also to have peaked and are starting to decline, but remain at very high levels still now. We are still averaging more than 700 new cases per day, down from the 1,200 that we had in January 13. In the past 24 hours, for example, a total of 200 new cases were reported. There were 91 COVID-related hospitalizations in the county as of Tuesday this week. 15 of those patients were in the ICU beds. The unvaccinated persons still account for most of the hospitalizations here, especially in our intensive care units. The number of COVID-related patients is impacting the capacity of our hospitals to care for other patients, with some surgeries needing to be postponed. Patients with COVID, even if that's not what they went to the hospital for, also need to be isolated to prevent spread, creating more capacity challenges. The county residents 65 and older have accounted for 74.2% of the 445 COVID-related deaths during the pandemic. Moving on, the large vaccine clinics continue open for the next 3 weekends at the county fairgrounds. The county is expanding access to pediatric and adult COVID-19 vaccines and boosters through large weekend clinics at the Sonoma County Fairgrounds. The clinics will be held in the Garrett building. We had a strong turnout the last week, with more than 300 people taking their vaccines in the first weekend, the last weekend. And the clinics will be open Saturday and Sunday for the next 3 weekends on February, from 9 a.m. to 4 p.m. In another note, Pfizer have asked the FDA to authorize vaccine for children under 5 years of age. Pfizer on Tuesday asked the United States to authorize extra low doses of its COVID-19 vaccine for children under 5, potentially opening the way for the very youngest Americans to start receiving shots as early as March. The nation's 19 million children under 5 are the only group not yet eligible for vaccinations against the coronavirus. If the FDA agrees, then Pfizer shots containing 1/10 of the dose given to adults could be dispensed to children as young as 6 months old. Pfizer is testing 3 shots after 2 of the extra low doses turned out to be strong enough for babies, but not for preschoolers. And the final data from the study isn't expected until late March. Only children between 6 months and 2 years old demonstrated an immune response comparable to that of older teenagers and young adults, the standard for a successful trial. That means that the FDA may consider whether to authorize 2 shots for now, with potentially a third shot being cleared later if the study supports it. The rate of vaccination overall for America's 28 million children in the 5 to 11 age group is lagging behind what health officials had hoped. Only 21% are now fully vaccinated nationally, and just 28.1% have received 1 dose. Rates vary widely among the states. In another note, the Moderna vaccine granted full approval by FDA. The Food and Drug Administration granted full approval on Monday to Moderna's coronavirus vaccine, the second most widely used in the United States, and the second to receive full regulatory approval. Nearly 75 million people have been fully vaccinated with the Moderna vaccine in the United States, with 204 million total doses administered. Full approval allows Moderna to market its vaccines under the name Spikevax. And lastly, the CDC warns against traveling to Mexico, Brazil, Chile, and the Philippines. The CDC has added 12 more destinations to its list of places that Americans should avoid due to very high levels of COVID-19. Mexico, which does not require visitors to show proof of vaccination or a negative coronavirus test, is now considered a level 4 country. Other countries and territories that moved to the CDC's highest level on Monday are Brazil, Singapore, and the Philippines. The level 4 list includes more than 100 destinations, with several popular Caribbean islands added last week. So that concludes my reports, and we can see that Omicron is all around the world in very high levels. This is still a very high level here in the county, even when we see these sharp declines from 1,200 last week average to today. We're having 200, yesterday 200 and 350, the day before 300. That's a good trend. The same with the hospitals, but yet those numbers are still way high from where they should be.
Yes.
As we had mentioned before, Rafael, we should be below 50 cases per day.
Yeah,
and we're obviously not there.
Yeah, so again, just a reminder to people, there's plenty of vaccines out there. And if you want to do it this weekend, you can go to the fairgrounds, you can take your different shots, the first one, the second one, the booster, and any of the shots for 5 years old and older. So please make your way over there Saturday or Sunday. And with that, I want to thank you as always, just reminding people if you're having a mental health issue that requires additional support, again, 707-576-8181, or the suicide prevention hotline for Northern California, 855-587-6373. Thank you as always, Senor Mejia. And we'll be talking with you next week, where we hope that you'll have even better news in regards to the number of people who are testing positive for COVID. Thank you.
It's really great to keep in that trend and to tell you next week that a lot of people got vaccinated.
Exactly.
That's what I hope.
Yeah.
All right.
Thank you.
See you next week. Thank you very much.
Bye-bye.